I refer patients who are having mental or emotional issues, or maybe just need a little extra empathy and support. And we refer to the therapists who are in-house. And it's a two-way street. They can communicate with us about the patient and how they're doing and give us feedback and give us insights that we wouldn't know about otherwise, because we don't have enough time usually to really dig deep with these patients and talk through things with them. But having Allied BHI here with us is huge, because it gives us the ability to send patients to them without having to wait a long time to see a therapist. Because we have them in-house, one, we can usually get them in within a week or two versus 4 to 6 weeks or even 4 to 6 months in some places. And Maggie, one of the care managers, her office is right down the hall from mine. So she and I talk almost every day. And if she has a patient that she's concerned about, she can come to me and talk about it immediately. And same thing, we have each other's phone numbers. So if there's an issue, we can call each other, versus if there's a psychiatric practice or a counseling practice, first we typically have to go through the main office number, and then we might get a call back a day or two later. But here it's immediate. Patients can benefit from Allied BHI because not only do they get therapy through BHI, but it also links us with a psychiatrist who reviews medications once a month. And so I am a primary care provider, and we are often the front line for psychiatric medications, but that doesn't mean that we are experts at managing psychiatric medications. It's very hard to get in to see a psychiatrist. And so one of the things that we do is, if a patient is really struggling, then we can meet with the psychiatrist once a month. There's no extra effort on the patient's part. We are advocating for them. And then if the psychiatrist recommends a medication change, we can implement that before they have to go through the process of getting in to see a psychiatrist. I have a patient who is a middle-aged gentleman, and he's going through a lot of personal issues with his family. He's also going through a lot of health issues at the same time, and he just doesn't really have anybody to talk to them about. And so I referred him to Maggie, one of our care managers. And the next time I saw him, he came in and was singing her praises, and said that it was just such a huge relief to have someone to talk to. And he didn't even really need anything specific from therapy. He just needed someone to listen to him, which I think a lot of people